right, so we are answering your COVID-related questions with Dr. Jay Wyatt, the Chief Medical Officer for Moses Cone Hospital. This question is, how many people are allowed in the birthing room at Cone Hospital?
Currently, we're back to our prior practices of allowing family members into the birthing room, and as long as you're not exhibiting any symptoms of COVID or have any known exposure, there shouldn't be any restrictions.
Do you have to show your vaccination card, or do you have to take a test before you come or anything like that?
No, you don't.
Okay, good to know. All right, this next question is, where do I get my second booster?
You can go to the conehealth.com/vaccine website, and that should show you what's available through Cone Health and also in other places.
Okay. This question is, I was due my second COVID booster and got COVID before I made the appointment. How long do I have to wait after having COVID to get my second booster?
What we recommended for any of the vaccines, including the second in series or the first booster, is to wait about 3 months.
3 months. Okay, we want to make sure that you hear that. 3 months you need to wait. All right. Are the symptoms of the B2 variant comparable to the other variants?
I think the mild cold-like symptoms are pretty much the same. The runny nose, the sneeziness, the cough. Some people still do lose their taste, but the virulence, the danger of it doesn't seem to be quite as great.
Okay, so but a lot of the same kind of things, respiratory and things of that nature.
That's correct.
Okay. This next one may be just a clarification, because the way that the question came out is, why is the vaccine not effective in children under the age of 5?
So we have not determined that it's not effective. We've just not shown that the efficaciousness of it in that age group is worth the risk of giving it with possible complications. So they're still looking at that, and I'm sure as soon as they find that sort of sweet spot where it is going to be a benefit to that age group, they'll start to recommend that.
This person is saying, I have a daughter that is still testing positive after 2 weeks after being the initial positive test. She's been cleared to return to normal activities. So how long can a person remain positive?
People can remain positive for COVID up to 3 months or so after they've tested initially and were symptomatic. And so what we typically do within the hospital setting for patients who are no longer showing symptoms, but we know they've had previous COVID within the last 3 months, we typically don't retest them because we think there's a very good chance they're going to test positive anyway. The infectivity of the virus that is detected on those tests is extremely low to zero. So they're not infectious, they're just still testing positive.
And I think that's like, that gray line. They're infected, but they're not infectious.
Correct. They're still shedding virus particles that are not infectious.
Okay. This person's saying, at 95 years old, should my mom get the third booster shot?
So it is recommended for people over 50. And so she is eligible to get it. Whether or not she needs to rush out and get it today or in next week, it's really a personal decision depending upon the risks that she has in terms of other medical conditions and what exposure she may be presented. But she is eligible to get her booster, the second one.
And then there is a follow-up. When will the new booster be available for 64 and up? And as you said, it's 50 and up right now.
50 and up right now.
Okay. This next question is, what about COVID long haulers? Is there any new developments? Will I be sick forever?
I get different messages from different people, and I think some of it depends on the severity of the illness that you get initially. For some people who were very, very sick to where they were on a ventilator for a long time or receiving high levels of oxygen, those are the ones that tend to have long-term symptoms with the long COVID pulmonary disease that can make it, that can really restrict your lifestyle. Otherwise, most people are plagued with fatigue and just some foggy, mental status, and that can last up to 3 to 6 months.
So if someone is still sick a year afterwards, they should be seeing their doctor so that they can kind of keep tabs on what's going on?
What we need to make sure of is that there's nothing else being masked by what we're calling COVID. You shouldn't be sick from COVID per se in a year's time. Maybe some of the after effects of it on your lungs and other body parts over a year's time, but it's not active COVID that's causing that. It's the damage that's been done.
Okay. This person says, what if you never took the booster, but you got both vaccines? Do you start all over again, or do you just get a booster?
You just get a booster.
My 3-year-old grandson has type 1 diabetes, so he's got juvenile diabetes. Would it be okay to get together with family who have all been vaccinated, and what precautions should we follow?
I would certainly, if he can tolerate wearing a mask, I would say he should wear a mask. But if everyone's been vaccinated, the risk is minimal. It's not zero. But I would certainly, see if he would wear a mask.
I love this next question. Will COVID ever go away?
Should I try to answer that?
I mean,
I think this is something that we're going to have to live with for years, sort of like the flu. And I think it'll be very naive to think that in a year's time or 2 years' time, we were going to get rid of it. We saw sort of a light at the end of the tunnel about a year and a half ago, and then that closed down very quickly. So we have to just sort of assume some form of this virus is going to be around for a while.
Some form of it, in some form or fashion. But life has seemingly gotten better and continuing to go on, so that is a hopeful thing.
It is very hopeful. What we need to do is try to stamp it out completely by getting everyone vaccinated. The more people that are vaccinated, the less it is transmitted. And the less that is transmitted, the less likely it's going to mutate into a form that could become more dangerous.
Okay, we're going to take a quick break. We're continuing to take your text questions. Feel free to text us while we're in the break, 336-379-5775. We've got another segment coming up right after this.